The next group of muscles that we will cover are the hip rotators, abductors, and adductors. The gluteus medius and gluteus minimus are the major hip abductors and medial rotators. Both of these muscles proximally attach at the posterior ilium and distally attach at the lateral aspect of the greater trochanter of the femur. As you can see, this means that as they contract or shorten, they will abduct the thigh at the hip. The fibers of these muscles also twist slightly as they make their distal attachment, especially that of gluteus medius. This means that this muscle is also responsible for medial rotation of the thigh at the hip. The piriformis and quadratus femoris are the only lateral rotators that we will discuss in these videos. The piriformis has its proximal attachment at the anterior surface of the sacrum and distally attaches on the greater trochanter of the femur along the posterior aspect, as you can see. The quadratus femoris has its proximal attachment at the lateral aspect of the ischial tuberosity and has its distal attachment along the proximal femur, just like that. As you can see, both of these muscles take a journey from a relatively more posterior proximal attachment to a relatively more anterior distal attachment. This enables them to enact lateral rotation as they contract or shorten. These muscles act synergistically with the other lateral rotators, including the obturator internus and superior and inferior gemellus muscles. The adductor muscle group consists of 4 muscles: the adductor longus, brevis, magnus, and gracilis. For the purposes of this content review, we will cover the muscles as a single muscle group. All of these muscles proximally attach along the pubis and the ischium, and they distally attach all along the linea aspera of the femur. As you can see, they are making a journey from a relatively more medial proximal attachment to a relatively more lateral distal attachment. This means that as they shorten, they would draw the femur in medially, causing adduction of the thigh at the hip.